Thank you. Um, okay, my name is Adnan. I'm from the Dementia Research Center at Nanyang Technological University, Singapore. And I'll be sharing about our application, which is for early detection of mild cognitive impairment. So, mild cognitive impairment is like a prodromal stage of dementia. You can also call it as pre-dementia. Different risk factors such as cardiovascular risk factors, lifestyle factors, genetic factors cause changes in the brain over many years. And then people can then develop dementia. And this is quite a critical stage because this is the stage that we can actually intervene at and actually slow down. In the past few years, the FDA has approved a few new drugs, and a few are also in phase 3 trials. So we need to detect people at the mild cognitive impairment stage or even before that to really have effective interventions. Um, and that's where our study, I'll share a bit about our study first. So, this is the biomarker and cognitive impairment study. It's the largest study in Southeast Asia for cognition. And it's a 3 to 5 year study with 1,500 to 2,000 people collecting brain MRI scans, psychological testing, as well as blood biomarker testing to really understand how does dementia manifest in Asians and how does it develop from a biological perspective. Um, and this is some of the data that we have collected so far. So we're now in year 3, and we have already started some year 3 follow-ups. Um, so one interesting finding, so our cohort is like a community cohort. So these people are not diagnosed with dementia or any psychiatric disorders. And the age is around 55 to 59 years old. What we are seeing is a very low prevalence of the ApoE4 gene, which is known to be a big risk factor for Alzheimer's disease and dementia. But we find that not a lot of our participants have that. But what we find is a high prevalence of white matter hyperintensities in the brain, which is a marker of vascular disease. And almost 40% of our subjects have moderate to severe WMH, um, which we can also term as cerebrovascular disease or cerebral small vessel disease. And in terms of mild cognitive impairment, almost 40% of our cohort has mild cognitive impairment, and they have not been diagnosed with anything yet. So there's a high prevalence in the community, and this often goes undiagnosed, and we only find people at mild or moderate dementia when they visit the clinic. So these are some of the biomarkers that we do. So plasma amyloid, plasma tau, inflammatory markers in the brain, neurodegenerative markers, and so on. And we're also doing some uh, exploratory biomarker analysis. And in terms of the brain and eye imaging, we also collect different sequences, uh, especially blood-brain barrier imaging as well, to get some more mechanistic insights. So this is just a rough overview of our research. So this is really the key finding that I was explaining earlier, is that Asian dementia is different from the West. And what are the factors that it's different on? We have a much lower amyloid beta prevalence in the blood, and also lower ApoE4 allele presence, but a much higher level of white matter hyperintensities. And this is in line with findings from other cohort studies as well that have shown that vascular type of cognitive impairment is much more prevalent. And that might actually be leading to Alzheimer's disease in the future as well. And we have a lot more mixed pathology in the Asian population. Yeah, so there have been previous studies as well. So this study was done in 9 Asian cities, including Bangalore, Singapore, showing a high prevalence of white matter lesions in the brain. Um, so really, the problem that we're finding is that a lot of people in the community have mild cognitive impairment, and they're not being detected. And why is it harder to detect, or why is it challenging to detect mild cognitive impairment, especially amongst our population? So, like I mentioned, we have a much higher prevalence of vascular disease, and vascular cognitive impairment manifests differently from your traditional kind of understanding of Alzheimer's. And some of the early symptoms are not so memory related. So, in fact, people always think of dementia as memory loss, But when we look at cognitive impairment, we have multiple domains of cognition. And especially with the vascular type, cognitive impairment is more related to executive function, processing speed, and so on, and not so much memory driven. So that's one of the reasons that it can go undetected till much later. And so basically, what we did was we kind of wanted to understand how does the vascular type of cognitive impairment differ from other types, and what is the difference between people who have high white matter hyperintensities versus low. And that is kind of that's what went into the application that we developed. So this is like the background. And you can also see here that people with high WMH, which is orange, so they have more executive function impairment as well as more processing speed impairment, and they have more impulse dyscontrol, which again is in line with more frontal impairment in the brain. So, so, and a lot of the current tests, like the MoCA or the MMSE, are quite focused on memory loss. So we really wanted to make something that is not just scalable, user-friendly, but also can be sensitive and specific in detecting vascular type of mild cognitive impairment. And that's our app, our solution. It's called the ReCOGnAIze app. It has a different cognitive gamified cognitive tests which detect different cognitive domains, cognitive functions, and then we have our algorithm that helps in detecting MCI as well as differentiating between the vascular type and other types. And basically, the algorithm that we built was based on the data that I showed on the previous slide. Then we also looked at comparing our, validating our app with participants. So we validated it in a subset of 250 subjects, and we had a AUC of 0.89. We had a AUC of 0.89 in detecting mild cognitive impairment with specificity and a sensitivity of almost 85%, compared to the MoCA, which was less than 70% accurate in detecting mild cognitive impairment. Because it is, like I mentioned, it's quite memory focused. And from a clinical and a translational perspective, pen and paper tests are not as user friendly or interactive as digital cognitive assessments. So we are also not just stopping at the assessment part, but our research is focused on creating assessments and also integrating it with biomarkers. We have a bunch of biomarkers that we are looking at combining our digital biomarkers with blood-based biomarkers as well. And from a translational perspective, we're also looking at developing digital therapeutics. So things that people can do at home, like cognitive training and so on, to kind of maintain cognition, especially if they're at a lower or a moderate risk. Um, and in terms of interventions, we also have a few studies ongoing, which are in different Southeast Asian countries where we are using a digital application in combination with ginkgo and other sort of supplements or drugs for cognition to see how it can improve adherence as well as basically adoption by users. So this is our team. We have a steering committee of international neuroscientists. Our director is a neurologist as well as a clinician scientist, and we have neuropsychology, imaging, biomarkers, and then technology, which I presented. And we recently also launched our tool commercially in a few private clinics in Singapore for health screening purposes. Yeah. And we're looking to do more collaborations and hopefully validate it in the Indian population as well. Thank you.
Thank you so much. Questions?
So you mentioned about the blood biomarkers.
Yeah.
So do you think correcting them can make a change in it? Just the blood biomarkers? Like the ones you mentioned was cholesterol, BP, and something else also.
Yeah, I mean, cardiovascular risk factors are definitely related to cognitive impairment, but I would say how the link is not so direct. Like everyone who has diabetes does not have cognitive impairment. So that can also be factored into the model, I would say, but it's not so direct like your plasma tau or plasma amyloid yet. So we don't really have a good marker for vascular cognitive impairment yet. So I think that's something that should be discovered.
No, my question was more like if you corrected those parameters.
Oh, okay,
Do
okay,
you
okay.
think it
Yeah,
can
yeah. Actually, I mean, there have been studies showing that intensive blood pressure control, like below 120 systolic, has shown improvement um, in vascular cognitive impairment. And we are also doing a study with SGLT2 inhibitors to see if that can improve cognition. And we also have Ozempic, right? Ozempic is also being repurposed for dementia. So I think there's definitely scope for that. But I feel like this is just my personal opinion, like when neurodegeneration has happened, we do need something more directly to the brain, which can repair the blood brain barrier integrity and so on as well. Yeah.
Okay, thank you.
Thank you. If there are no more questions, I actually had a question myself.
Sure.
So, the app that you detect cognitive impairment, have you tried to correlate that with amyloid deposits that you have?
Yeah.
And is there any correlation at all? So,
Yeah, I mean there is a correlation. The problem is that in our population, very few people have amyloid deposits. Like that's what the thing is, that amongst Asians, amyloid deposit levels are lower than the Western population. So it is correlated, but very few people have higher levels of amyloid.
very interesting. Thank you very much for
Thank
the
you.
talk.